Hi, my name is Natalie Boone, and we are in a group together and we're talking about Canada's global health systems policies. Also in the group, we have Eliza, Nina, Madeline, and Lexi. And we're going to start off with the overview of the healthcare system.
So first for coverage, the type of insurance Canada has, they have a publicly funded healthcare system. So instead of having a single national plan, they have 13 provincial and territorial healthcare insurance plans. Under the system, all Canadian residents have reasonable access to medically necessarily hospital and physician services without paying out of pocket. This program is called single payer because it is paid through a single source, which is the Canadian government, which also means that their system is not socialized. Canada does achieve universal coverage and the removal of cost barriers. So, some of their benefits, one of them is portability. The provincial and territorial plans must cover all residents when they travel within Canada. There's also public administration, which is territorial and provincial plans have to be operated and set in place by a nonprofit basis. This means it's ensuring all needed care services, such as physicians, hospitals, dentists, that are in a hospital setting and cover all residents, including inmates, Canadian Force members, First Nation people on reserves, and eligible veterans. This gives all residents reasonable access based on medical needs versus the ability to pay. For supplemental, the coverage is available for supplemental. Those who decide to buy supplemental plans obtain coverage in prescription medicines and dental care. Other benefits include retirement savings, long-term disability benefits, life coverage, and more insurance on the other services and medications.
So Canada is financed, as we discussed. The government is the payer of most of their services. So the provinces and territories' public health insurance is funded by government revenue, and various taxes contribute the greatest portion of funding for public health insurance. But also, according to the Canada Health Act, the Canada Health Transfer is an organization that accounts for 24% of total government financing to the provinces and territories. So that is the public sector, which is provided by the government, that is offered to all residents of province and territories. And those, are, as discussed before, that is coverage deemed medically necessary, but that varies from province and territory to province and territory. Services not covered by the public sector are often covered by mostly employer issued private insurance. So a large portion of residents do choose to apply for private insurance, mostly through their employers. And those plans have varying conditions, including premiums and deductibles, as far as how much they have to pay to cover those services that are not medically necessary, such as prescription drugs or dental or vision. But in general, there's no cost sharing or out of pocket costs for public services whatsoever. But also, as far as safety nets, there's this thing called a safety net, and different provinces offer assistance for services not covered by the standard healthcare plan. So, depending on the province, those cost assistance programs may apply to seniors or those on social assistance. And there are just a varying amount of conditions for each province and territory. That might be a lower out of pocket copay, or it might be completely covered, or whatever it is, but it's considered like a last ditch effort if you are having to pay out of pocket for services and are unable to afford those.
So, in terms of affordability, Canada has a universal coverage system, like we talked about, which means healthcare is definitely affordable for patients and includes very few out-of-pocket costs. There's no cost sharing, like we talked about, for services covered under public insurance. And if patients don't have private insurance, like from an employer, they may have to pay out of pocket for things like dental care, vision care, or prescriptions. And then like Maddie talked about, there are safety nets such as outpatient drug plans and tax credits that those without the private insurance can fall back on. And some ways that Canada contains their costs and make sure nothing's getting too expensive is they have single payer purchasing, mandatory global budgets, negotiated fee schedules, specific drug formularies for drug plans in each province, restrictions on resources for providers to make sure that they're not spending too much in one area versus another, restrictions on new investments in capital and technology. And then they also have different organizations that play a role in this cost containment, like the Canadian Agency for Drugs and Technologies in Health, patented Medicine Prices Review Board, the Pan Canadian Pharmaceutical Alliance, and the Choosing Wisely Canada campaign.
Okay, so next we have quality of care. How good is the healthcare in Canada? And unfortunately, when compared to other high-income countries, Canada is ranked relatively poor. This is from the Commonwealth Fund report, and they are ranked 9 out of 11. They use a combination of administrative data and surveys of patients and providers, and they rank them in 5 categories, including care, access, administrative efficiency, equity, and healthcare outcomes. On a health quality measure, we have 3 charts down here. The first one is the child mortality rate. Canada would be in the purple, and red is the world. And then we have North America and the United States. Canada actually ranks below both of those, having a lower child mortality rate. Also, in maternal mortality rate, they are lower than the United States, as seen in the second graph. And in the third graph, they actually had the highest life expectancy out of North America, the United States, and the world. So, on a data measure, they're doing pretty good in healthcare. They just might have some satisfaction and care issues whenever it comes to their ranking from the Commonwealth Fund.
Sorry. So the next one is provider satisfaction. So Canada has 17 medical schools, and the average tuition of these is 14,780 Canadian dollars, which is about 11,000 US dollars. So compared to the US, this is obviously very, very affordable. Um, And in terms of salaries, it just depends on the provider's scope of practice or whatever area that they're in. So, for example, the average payment for family medicine in 2016 to 2017 was about 276,000 Canadian dollars, which is about 219,000 US dollars. Medical specialties was around $357,000 in Canadian dollars, and surgical specialties was around $477,000 in Canadian dollars. Um, and based on a study done in 2013, 72% of providers said that they were satisfied with their profession. However, only 49% said that they were satisfied with their work-life balance. So, as Natalie said, they have a good healthcare system, but there needs to be a little bit of work done on provider satisfaction.
So next are the implemented policies in Canada. So for the first one, funding drugs for rare diseases. So funding is distributed to increase affordability and access for rare disease effective drugs, therefore improving rare disease cases throughout Canada. This funding contributes to new and existing rare disease medications and creating new drugs for rare disease using the Common List. The Common List is designed to help develop, collect, evaluate, and use real-world data and evidence to make decisions about the listing and reimbursement of rare disease drugs within Canada's existing pharmaceutical management system. The benefits of this is that it improves diagnosis for rare diseases, improves screening for rare diseases, reduces rare disease cases, and then brings more attention to research and prevention. This could benefit the US because in America, this policy could improve the generation of real-world evidence of rare disease cases, and then this policy in the US would help decision-making and improved access to rare disease drugs.
So a second policy is sex and gender-based analysis policy, and this is where the government of Canada's health portfolio implements sex and gender-based analysis plus into a patient's health portfolio to develop and evaluate the health portfolio, research, surveillance, legislation, policies, regulations, programs, services, and other initiatives. And some benefits of this is that this approach conducts an analysis to understand how identifying factors such as histories, power relations and the distribution of resources in an individual's reality contribute to differences in health-related resources and health outcomes. This takes into account that there are inequalities in access to healthcare and works to research on how to fight this. This policy is aimed at strengthening the integration and application of SGBA plus into all health portfolio activities to advance equity, diversity, and inclusion. The engagement of diverse stakeholders and partners to understand lived experiences and better address population-specific impacts and needs. And reasons that this could benefit the U.S. is that this could help America create more equitable and effective policies that are effective by considering impacts on various genders and other groups to improve minority healthcare outcomes. And policies that consider the needs of all genders and social groups can create a more inclusive and harmonious society.
So the third policy is reducing urban heat islands for health. So urban heat islands refer to warmer temperatures in urban areas and surrounding rural areas, magnifying health impacts. So the policy implements prevention measures in urban communities. Examples are vegetation cover, implementing climate-sensitive urban design and planning, integrating natural ventilation water features, and receiving waste heat production, which, as we know, global climate change is a significant issue. So this kind of accounts for that in Canada-specific areas. So this approach reduces heat-related illnesses and deaths by alerting the public and public health professionals about extreme heat events and activating established measures to help protect vulnerable populations. Increasing urban green space reduces outdoor temperatures and therefore physical activity, which is a component of health. And increasing vegetation benefits some marginalized and lower income groups living in certain areas, which allows them to have greater access to produce and healthy nutrition such as that, and introduces naturally inspired design choices, which are better for the environment. So the reason this could benefit the United States is reducing urban heat islands can decrease heat-related illnesses and improve overall public health, and allows for better energy savings. Cooler cities means less need for air conditioning, leading to lower energy bills and reduced emissions. So in general, heat could specific areas of heat cause some certain complications with health in many different ways. And if we could implement this policy in the United States, we could potentially take a bite out of those issues that are facing the United States healthcare systems.
So for our final policy, it's the Canadian Health Act, which is like their Medicare. And Canada's publicly funded healthcare insurance ensures that all eligible residents have access to medically necessary healthcare services without direct charges. So some benefits of this approach is that universal access to healthcare without financial barriers promotes equity and health outcomes across the population, and standardized care access provinces from establishing national principles for healthcare delivery. This helps maintain consistent standards of care across the country. Reasons that this approach could benefit the U.S. is that by adopting principles similar to the Canadian Health Act, the U.S. could provide universal healthcare access to all residents. This would reduce the number of uninsured individuals and improve overall public health outcomes. And by eliminating the need for complex private insurance systems, the U.S. could reduce administrative costs and achieve more cost-effective delivery of healthcare services. And then on our next slide, we have our references, but that pretty much sums up our Canadian healthcare policies. Thank you.